Okay, let's dive in. There's a really tough reality we need to talk about: maternal mortality in the U.S.
Yeah, it's particularly concerning for mothers who are eligible for Medicaid. The stats aren't great.
And they get even worse when you focus on specific places, like Baltimore. Our sources show Black women there face a risk that's, what, more than double?
2.25 times higher, yeah. It's a stark disparity, a critical problem.
Absolutely critical. And that's really the heart of what we're looking at today, this initiative. It seems, well, really promising.
It does, and the core idea starts with doulas. We know it's proven, really, that their support, non-medical support during pregnancy, birth, postpartum, it makes a real difference, better outcomes.
Right. So Doulas work, that's established. The problem isn't their effectiveness.
No, not at all. The challenge, and this is clear from the material, is the system. It's incredibly difficult for doulas to navigate the process to become registered Medicaid providers.
Which is exactly what they need to do to reach the mothers who often need them most, right? The ones covered by Medicaid.
Precisely. You have this effective support, but there's this huge barrier to connecting them through the official payment system.
Okay, so that's the gap stepping into. It started as a grassroots project.
Yeah, very much grassroots. And now they're developing an app right there in Baltimore. Their mission is pretty clear: healthy births, sustainable jobs.
Healthy births, sustainable jobs. I like that. It connects the dots, help mothers, but also help the doulas build a sustainable career doing it.
Exactly. Make it viable for doulas to get paid consistently through Medicaid so they can actually serve more of these families in vulnerable situations.
And the timing seems, well, pretty perfect. Maryland Medicaid now reimburses for doula services.
That's a huge development, up to $1,447 per birth. That's quite significant. It shows a real commitment from the state.
So the money is potentially there. About making sure doulas can actually access it, unlock that funding.
Right. It's about streamlining that whole process. And they're doing more than just building an app, based on our sources.
Oh, yeah. What else?
Well, they're building a community, a network for doulas,
Mm-hmm.
helping them connect, share resources, stay updated on all the Maryland Medicaid rules, which can change, you know?
Mm-hmm. Keeping up with bureaucracy.
And they're also involved in advocacy, working with the Doula Alliance of Maryland to try and improve the benefit itself, make it even stronger.
That's important work. And they're focusing specifically on Baltimore community doula groups.
Yes, and specifically emphasizing culturally congruent doulas.
Okay. Explain that a bit more. Culturally congruent.
It means doulas who share similar backgrounds, cultural experiences, language sometimes with the mothers they serve.
And why is that so important?
Because trust is fundamental. Having someone who understands your background, your perspective, your potential anxieties or cultural nuances around birth, it can make a massive difference in communication, comfort, and ultimately in outcomes. It directly addresses those deep-seated disparities we see.
Right. That makes complete sense. Focusing on empowering those specific doulas seems like a really smart, targeted approach.
It's definitely one of the initiative's strengths.
Okay, so back to the app itself. It sounds like the core tool here. What's the plan for it?
The idea is to make it a step-by-step guide, taking doulas through everything: education requirements, getting certified, the networking piece, even navigating the payment system.
Basically making sense of a system that, as the sources say, was really built with doctors and traditional medical providers in mind, not necessarily doulas.
Exactly. And it's not just for the doulas. The app is also meant to help birthing individuals find and connect with those culturally congruent doulas in their area.
So a two-sided platform, essentially, connecting supply and demand within that specific Medicaid context.
You could put it that way. It's a really holistic approach, tackling the admin hurdles, building community, advocating for change, and using tech to link everyone up more effectively.
Okay, so where did this all begin? What's the origin story? You mentioned Roots ID.
Yeah, it is a Roots ID project.
Right.
And its roots, pardon the pun, are really dug into tackling that maternal mortality crisis right there in Baltimore City.
So it didn't just spring up as an app idea.
No, not at all. They've apparently been doing manual work for the past 2 years, actually working hands-on with the Maryland Health Department,
Doing what exactly?
helping culturally congruent doulas get enrolled with Medicaid, like guiding them through the existing complicated process manually so they've seen the pain points firsthand.
Ah, okay. That makes a huge difference. So the app is born from that direct, on-the-ground experience.
Exactly. It's not theoretical. It's based on what they learned actually doing the work.
And who are the people behind this? Our sources mentioned a few names.
Yeah, it looks like a strong mix. Annie Bird, she's involved with UMBC and community leadership and a co-founder. Anna Rodney from Omen Cares, McNye Arafane from the Baltimore Doula Project.
So deep community connections there.
Definitely. And then on the tech side, from Roots ID, you have Lance Bird, the CEO and a developer, and Rodolfo Miranda, the CTO, also a developer.
That sounds like the right combination.
Mm.
People would understand the community's needs and people who can build the tech solution.
Right. That synergy is absolutely vital. You need both. And the plan, as they state it, is to use this app to scale up the impact they were already having, leveraging Roots ID's digital identity platform.
Digital identity. Okay, we'll get more into that. But first, let's walk through the app itself. From the Doulas perspective, our sources, including that beta test video transcript, give us a pretty good look. Step one seems to be about getting organized.
Right. Documents, certification. It can feel overwhelming, so the app breaks it down.
How so?
Well, it asks you, which organization trained you? Then it lists exactly what documents Maryland Medicaid requires based on that. No guesswork.
Okay, that's helpful.
And you can upload your certificates right there. There's this visual progress circle, so you see it filling up as you complete things. Little wins.
That visual feedback is probably quite motivating. Keep you going.
Yeah, it helps you track everything. And it acknowledges things like doula insurance and background checks. You can upload them. It's helpful. But it clarifies they aren't strictly required for the Medicaid part.
Good distinction. Yeah. Okay, step two. The NPI, National Provider Identifier. That's official.
It is. It's essential for billing Medicaid. Another potential roadblock.
So how does the app help here?
It explains the difference because there are two types. Type 1 for individuals, Type 2 for groups. It tells you which one you likely need.
Okay.
And it gives you direct links. You can check the official NPI registry to see if you already have one, or get guidance on how to apply. Again, trying to remove the friction.
Makes sense. And you mentioned that visual tracker, green for done, orange for still needed.
Yeah, and apparently you can just click the orange item and boom, it takes you right to that section in the app. Very user-friendly design thinking.
Nice. Okay, step three gets into the business side.
Right, managing the doula practice as a business, which, not everyone's starting out as an expert in.
True. So what does it cover?
Things like your EIN, your employer identification number from the IRS. It guides you on entering that, helps you complete and upload your W-9 form.
Okay, standard tax stuff.
Yeah. And then the Maryland-specific things, like the eStat number. It even links you to the state's business entity search tool to help you find or register it.
Handy.
And finally, uploading that official IRS letter that confirms your EIN. So all that crucial business paperwork is gathered and organized.
So once you've got all those green check marks or filled that progress circle, what's next?
Then the app basically says, okay, you look ready. Ready to tackle the actual Medicaid application on their official portal. There's even a checkbox in the app to say, yep, I'm ready for that step.
And after you apply and hopefully get approved.
There's a final step in the DoulaID app to record your official Maryland Medicaid provider ID number once you receive it. Kind of closing the loop.
And they're looking for feedback throughout this.
Yeah, that little text bubble icon in each section, it shows they're building this with the doulas, not just for them. That iterative process during beta testing is really key.
Definitely sounds like they're trying to make a complex process much, much smoother.
That's the goal. Reduce the administrative burden so doulas can focus on the actual birth work.
Okay, now let's shift gears a bit. Let's talk about the tech. You mentioned digital identity, Roots ID, and our sources bring up Cardano.
Right. So isn't just a standard web application. It's built on the Roots ID identity platform, which in turn uses the Cardano blockchain.
Why Cardano? What does the blockchain bring to this?
It provides the foundation for what's called cryptographically verifiable digital identity.
Okay, break that down. Verifiable digital identity.
Think of it like a digital passport, but for specific credentials. It allows a doula to prove their identity, their certifications, their qualifications in a way that's highly secure and can be instantly verified by others, like Medicaid or a client, without needing a central authority to constantly check. It's tamper-proof.
So more secure and trustworthy than just uploading a PDF of a certificate.
Oh, much more. And the interactions can be transparently recorded if needed. The system uses tools from the Cardano Foundation, specifically their open-source identity wallet and standards known as, Key Event Receipt Infrastructure. It's a standard for secure identifiers and digital credentials in this decentralized world. They also use something called the Roots ID Cardano Superwatcher,
which was funded through Catalyst, Cardano's community funding mechanism, right?
Exactly. Fund 11, I believe. So this project is deeply integrated with the Cardano ecosystem, and it's developing identity tools.
And it seems like they're not just using these tools, they're contributing back. The sources mentioned contributions to the Cardano wallet, the Superwatcher.
That's right. It's very much an open source collaborative approach. They're building their solution while also strengthening the underlying technology for everyone else. That's quite significant in the blockchain space.
And for the doulas themselves, what's the real benefit of having these verifiable credentials?
It gives them control. They own their digital identity and credentials. It creates a secure, portable, verifiable record of their training, their experience, their career milestones, even financial achievements potentially. They can share proof without giving away unnecessary data.
Okay, that sounds powerful. So let's zoom out again. Beyond just the tech and the app's features, what's the bigger vision here?
The number one goal, always, is reducing maternal mortality. Increase the number of Medicaid-registered doulas, especially culturally congruent ones, serving those high-risk populations. That's the core mission.
Right, healthy births.
Healthy births. But they recognize it's not just about technology, it's about coordinating people and organizations. Business challenges, stakeholder alignment,
So they're actively working with.
local doula groups, the training organizations, healthcare practices, hospitals maybe, and definitely the Maryland Department of Health, trying to get everyone on the same page.
Connecting the dots again. Now, the sources mentioned something technical, VLEI. What's that about?
Okay, so the Global Legal Entity Identifier Foundation, they issue LEIs, legal entity identifiers. Think of it as a globally recognized ID number for organizations, used a lot in finance.
Like a universal business registration number.
Sort of, yeah. Now, it has developed a verifiable credential version called the VLEI. It's a way for an organization to digitally prove its identity and key information is correct and verified.
And he is aligning with us.
Yes, it connects their system to this established global framework for organizational identity. It adds another layer of trust and interoperability.
So let's bring it back to the doula using the app.
Mhm.
Does she need to understand LEIs and carry witnesses?
Absolutely not. That's the beauty of it. All that complexity should be working under the hood. For the doula, the app just simplifies things. It makes it easier to prove her qualifications to a training company, or get insurance, or enroll with Medicaid.
So what are the key advantages of using this decentralized identity approach for something like,
Well, several. It incentivizes people to participate because they control their own data. Doulas don't need a dozen different logins for different systems. Organizations have less IT burden, less liability managing user accounts. It boosts access and support.
okay,
You get that cryptographic proof, which increases trust and cuts down on fraud. It empowers individuals, especially maybe non-traditional learners, by giving them ownership of their records. It promotes interoperability, potentially connecting with that global LEI network, and it's built on open source standards.
that's quite a list of benefits. It sounds really transformative if it works as planned.
It has that potential, yes. And there's already trying to influence the broader system. You mentioned they shared a report with the Maryland Department of Health.
Yeah, with recommendations for improving the state's doula registration process.
Exactly. And they plan to publish more reports like that, sharing what they learn with everyone involved, training organizations, insurers, policymakers, trying to improve the whole ecosystem.
So the ultimate measure of success comes back to,
The number of doulas they help get registered with Medicaid, that's the core metric. More registered doulas means more support for mothers, potentially lowering those mortality rates.
and for Cardano, the network this is built on, what's the benefit if DoulaID succeeds?
It's huge visibility. It demonstrates Cardano's real-world utility in tackling a major social problem. It showcases its decentralized identity capabilities. Remember, this could be the first production decentralized identity app built on Cardano.
A significant milestone.
Absolutely. Plus, the project has a good track record with Catalyst funding and delivering open source contributions. Their proposal metrics, engagement numbers, doulas starting training, registrations, those will be key to watch. And their ongoing contributions to the identity wallet, the Superwatcher, the Carry tools, it all strengthens Cardano.
Okay, so just to wrap up the core idea here, DoulaID is using this blend of very hands-on community work and sophisticated decentralized identity tech on Cardano.
To directly address the maternal mortality crisis in Baltimore, focusing on empowering culturally congruent doulas to get registered and paid by Medicaid.
It's a really focused, innovative approach, tackling a specific urgent local problem, but with technology and a model that could potentially scale or be adapted elsewhere.
Precisely. It holds promise not just for Baltimore, but maybe for other places, other healthcare challenges, where navigating complex systems creates barriers to care and leads to inequitable outcomes.
It really makes you think, doesn't it, about the potential of this kind of decentralized tech. Simplifying things, empowering people caught in complex systems, especially where the social impact is so high. You start wondering what other areas could really benefit from this approach to create fair access, better results for everyone.
That's a great question to ponder. Where else could this model make a difference?